Governor, thanks for making time for us today. We know there are some rallies planned today in Raleigh, here in Mecklenburg County as well. Some people want to see you reopen the state quicker, think you're being overly cautious. Even earlier this week, Gaston County temporarily had plans to defy your order. Are you feeling the pressure?
Well, I want to get our economy going as quickly as possible, but we have to do it in a methodical way that continues flattening the curve and making sure that we don't overrun our hospitals. We have a three-phase plan that hopefully we'll begin to go into at the end of next week. It will also bring the people along with us. I think that this is a minority of people who are trying to get us to take off all of the restrictions. I think if we did that you could potentially see a spike of cases which would overwhelm our hospital system. And I also think many people wouldn't participate in the economy because they wouldn't feel safe. We've got to make sure that they do feel safe. And when we do this in a methodical way, I think that is the best way going forward, because we have to keep the health and safety of North Carolinians as the number one priority. But we do need to cushion this economic blow, and our phased-in approach, I think, will work. It's unfortunate that the statements were made in Gaston County. That causes confusion in the middle of a pandemic, which can be dangerous. They really were unnecessary statements, because the order that Gaston County actually put out recognized that the state order was still in effect. We're all in this thing together. We've got to work together. Yes, we're going to have differences of opinion. We're taking a lot of advice from the business community about how we open up so that they can optimize what they do, how they can make their employees and their customers feel safe. And I think North Carolina will be better off at the end of the day if we do this with care and not haste.
I know the state and Mecklenburg County are both reviewing death certificates at this point, with the expectation that down the road there will be more COVID-19 confirmed deaths. Do you believe this will be more far-reaching than is reported right now?
You know, we have not known a lot about this brand new virus. And I think it's pretty clear that across the globe that people were infected with this virus and either recovered or maybe even died from it without people's knowledge, because the tests really didn't become available here in the United States until February and March. They were only more widely available then. So I think it's perfectly reasonable to think that there were coronavirus deaths that occurred before people knew what it was. I think we know that this virus can be deadly. We also know that people can be carrying the virus and be asymptomatic. So what we want to do is to make sure as we emerge from this that we take precautions to keep people as safe as possible until we can get a vaccine, and to find ways to make sure we can get our economy going. I know a lot of families out there are hanging by a thread, a lot of small businesses that have worked all of their lives to build a business, and now they see it deeply at risk. So we've got to find ways to methodically get people back into commerce, get people working again, and do it in a safe way. And I'm committed to working with our business community and our health officials to get that done.
Where does North Carolina stand with testing right now? I know you want to at least double the daily amount of tests. You made that announcement more than a week ago. What's the biggest inhibitor right now?
We're making extraordinary strides in testing. We're getting more supplies. We're getting more lab capacity. We're dealing with 14 labs throughout the state now. We're creating more places where people can get tested. We also have loosened the criteria for doctors to be able to order tests for their patients. For example, we had 5,000 tests administered yesterday, and we want to get at that level consistently, and in the future get even significantly higher, because the more tests you can do, the better idea of the scope of the problem that you have. And particularly as we phase in our openings and get people back into business and back at work, the ability to go in and test a lot of people and to find out where the problems are and to get people isolated and protect everybody else, having those tests will be critical. So we're going to continue to work. I realized a month and a half or so ago that we were not going to be able to depend on the federal government to provide all the supplies, the testing kits, the personal protective equipment that we need in order to do testing. They've helped. We've appreciated it. But we know that it's going to be up to us as a state. So we have a testing surge group where we pull people together. They are working to increase testing. Another important part of this is contact tracing, where you have someone who tests positive and then you go talk to the people with whom that person has interacted to see if they need to be isolated and to see if they should be tested for COVID-19. Those are the kinds of things that are going to help us operate more safely and more efficiently, and are the kind of things that are going to help our economy move as we move through these phases, and that's truly important.
And Governor, as we close up, we're about 3 months away from what is the largest planned event in the world right here in Charlotte. Right now, planned is expected, the Republican National Convention. Do you think our state will be in a place where it's safe to host that convention? And if so, do you think the state will have to impose any restrictions?
It's too early to tell right now. What I know is that both the Democratic National Convention that will be held in Wisconsin and the Republican National Convention, they are talking to each other. I know that they are talking to various state and local officials about if they do hold these conventions, at what kind of level would they be held. The bottom line here is that it is too early to tell. We need to look at all of our indicators, the percentage of hospitalizations, the number of positive cases, the percentage of positive cases from the total tests run. These are the kinds of indicators that we're going to be looking at to determine our phases and determine what kind of activity is safe to undertake. So it's just too early to tell at this point. You know, what we're hoping is that our economy can be up and running as much as possible so that we can get people back to work who aren't working now and get businesses open that aren't open now. But that kind of thing, we've got to wait a while longer to be able to tell what we're going to do.
Well, Governor, I think my time is up. I appreciate you making yourself available to us and communicating with us today, and I hope you stay well.
Thanks a lot, Nate.